Hi, everyone. For those of you that are coming in, happy Juneteenth to you all. We are definitely excited to have this conversation about PrEP, PEP, and HIV treatment MythBusters. We're going to be busting up some myths that a lot of people have been misinformed about. So we're waiting on our good sister Cholie to come on. And thank you to Unspoken Treasure Society for actually having this type of conversation that's really needed, because there are a lot of misconceptions and myths in regards to PrEP, PEP, and HIV. During my research, there were a lot of things that I did not know that I now know that I cannot wait to share with each and every one of you all that are going to be watching this live. Get some pen, get some paper down, get some paper so you can write some things down, and get ready to learn. We're here to, I'm here to share the information that I learned, because I'm not an expert on these things. I'm not a doctor in any type of way. It's just from my own personal research that I've looked up and I've read and found very interesting. So I'm excited to get this thing started while we're waiting. While we're waiting
for Chloe's here.
Hey.
Hey, lady.
How y'all doing?
Well, how are you?
Hey, where's the camera? Hold on.
Where's your camera, honey?
Hey, hold on. Okay, there we go.
Hey.
How y'all doing? Good.
Awesome. So I was just kind of doing an introduction, just to let them know we're here to break up some myths about PrEP, PEP, and HIV. And in my research, and you doing your research, and you actually being in the actual arena of being a correct me, a clinical researcher of these things. Mm-hmm. Yeah, I've said I'm not a researcher. This is not my area of forte. I am just busting up some myths based off research that I found and discovered to be very helpful, even in my own personal understanding of PrEP, PEP, and HIV. So I'm excited to get this started.
Yeah,
so
absolutely. First of all, I would like to say thank you, Unspoken Treasure, for having me here. I am elated, and I'm a big fan of yours, Zarion. I love you for all that you do. So it's an honor for me to be alongside you today. So I'm really excited, and thank you everyone who is joining us. So we have a lot of information for you today. So
very interesting. So there is an echo.
There's a feedback, yeah. Okay, so thank you everyone for joining us today. So I guess what we're going to do is break this into treatment. Well, we're going to break it into prevention, treatment, and then questions and answers. So anyone out there who has questions and answers can send us the questions, and then we can answer all of your questions for you. So once again, I'm Cholie Jordan. I'm a clinical research coordinator of the LIGHT study, which stands for Leading Innovation for Transgender Women's Health and Empowerment. I'm an Atlanta native, and I'm going to be discussing all things PrEP. So for the sake of time, I'm going to jump right on in, because over the years, I have heard and answered many questions. People have asked me the craziest of questions, and I've heard and I've answered many questions, a lot of misconceptions about PrEP. And I figured that this would be a great opportunity to do it in a more public sphere. Mm-hmm. So first of all, let's go over exactly what PrEP is. PrEP, so for those that are not aware, PrEP stands for pre-exposure prophylaxis. A prophylaxis is preventative health care. So anything that you do that is prevention towards your health care is a prophylaxis. So this one in particular is against HIV and AIDS. PrEP is the use of antiviral drugs as a strategy to prevent yourself from contracting HIV in the event that you are exposed to HIV. The most common ways to become exposed to HIV are through vaginal sex, anal sex, or with someone who is HIV positive, or through needles. So maybe becoming stuck by a needle mistakenly, or sharing drug use needles that were previously used by someone who is positive. So that is one of the first things that a lot of people don't really understand, is just what PrEP is. They hear this word PrEP, but they don't really know exactly what PrEP is. So now that we've discussed that, let's segue into PEP, because PEP goes right along with PrEP. So PEP is post-exposure prophylaxis. This is taking antiviral medications after being potentially exposed to HIV. So PrEP is before you become exposed or potentially exposed, and PEP is once you feel you have had a situation that has exposed you to HIV. You have 72 hours or 3 days of possible exposure to begin PEP. So PrEP, on the other hand, has a lead time of 7 days or a week, which means you have to take it for at least that time before it can become effective. PEP is to be taken for 28 days total, while PrEP is something that you take for the entirety of time that you and your healthcare provider deem fit. So, the best way to take your PEP, universally it's said that you can take PEP anytime. You could take it with or without food. But personally, I think that it would be best to take it right after dinner, because you'll have a full stomach and it's the end of your day. So you'll be able to go to bed in the event that you have any mild discomforts. So I think that's, personally, if you ask me, what I would suggest that. So the drugs that constitute PEP, what can be taken as PrEP? This is another, because I've had people say to me, well, if my lover is positive, can I just take their medications for PrEP? No. No, you can't. Effective medications must be studied for a long time to examine the long-term effects of taking an antiretroviral drug for PrEP, and then it has to be FDA approved. And currently there are 2 pills that have been approved. One is Truvada and one is Descovy. Truvada is a single pill, and I'm going to teach you some words today, because people always say, well, what's the difference? What's the difference between Truvada and what's the difference between Descovy? They are similar. They are kind of sister cousins, but they're not exactly the same. Truvada is a single pill that contains emtricitabine and tenofovir disoproxil fumarate. Ooh. So, yeah, I know, I'm a slow down. Emtricitabine, and so that's emtricitabine is one. Tenofovir disoproxil fumarate is another. So for short, we call it TDF, right?
Okay.
So I'm teaching you this for a reason, right? So Descovy, on the other hand, is a single pill that contains emtricitabine and tenofovir alafenamide. So there's this slight difference. Exactly. So we call that one TAF. So there's a difference, which is why there was a need for this newer medication, because as I shared this with you, because people assume that they are the exact same, but there are subtle differences, and the TDF has been known to cause kidney problems, and a small amount of bone loss in some, while TAF is likely not to cause those problems. So that that AF makes it a different chemical compound that responds differently to the body. So there are differences between TDF and TAF.
Can I just say something right here real quick?
Sure.
Everyone, please make sure you have pen, paper,
Yeah.
writing this information down, because we are talking, you are actually listening to someone who studies this. So this is important. Please write this information down.
Yes, please get your pens, your paper, your pads, take your notes. So who should be taking PrEP? So medically, they will say people who are high risk. What would constitute high risk? High risk population. So right now, people who are African American or of color, who are between 18 to 24, who are sexually active MSM, or men who sleep with men, or transgender women, would be considered medically the highest risk. Personally, I think everybody should take PrEP. I think if you're having sex and you're having sex outside of marriage, I'll say it that way, I think everyone should be on PrEP, because you just never really know. I think that being on PrEP, it allows you to take back the responsibility of your sexual health, if that makes sense. It allows you to not have to worry about someone else being responsible. Because at times, as we know, people may not deem themselves fit to be responsible for your sexual health. So I feel like it's a way to take back your own sexual health, personally. So I think anyone who is sexually active, with multiple partners, or even with a single non-monogamous partner, I think that you should definitely be on PrEP personally. So will PrEP prevent you from other STIs or STDs, sexually transmitted diseases, or sexually transmitted infections? No, absolutely not. Neither pill will not prevent you from gonorrhea or chlamydia or syphilis or trichomoniasis or herpes or any of the other STIs. So for those reasons, it is for you to still practice safe sex with a condom. I always say to people that I think PrEP is one of those things that are like car insurance, like auto insurance. It's one of those that, yeah, I think
that's a good way of putting that, though. It's a good way of putting that.
It's one of those things that you're like, well, I don't think I really need this. But in the event that you have that accident, it's really great that you have it, and you're going to be thankful that you do. So I think that's going to be about it on my end for your prevention. And I'm very interested in hearing my fair lady about treatment.
Oh, goodness.
We're going to, like I said, get into some questions. Have some questions ready, everyone. Make sure you're taking notes and you're writing your questions down so you can have the opportunity to ask us at the end.
Yes. All right. So my name is Zarion Newbill, for all of you who do not know me. I am the CEO and founder of NOMO Organization here in Atlanta, Georgia, and we also have a chapter in Macon, Georgia. And it is a nonprofit organization for transgender women of color. We have support groups. So two of our main targets are support groups in our community, as well as education. And I want to kind of put this prerequisite out there that I am not a specialist in this. I am not a doctor. So I want to put that out there. So don't go out there and be like, well, Zarion said, nope, I'm putting it out there. So I'm protected from any false information that I may give, or if anything is misguided, please forgive me. I am just going off the basis of what my understanding and reading the information that I was received. So I wrote down, I went on a website and found 6 MythBusters in regards to HIV. And so the number 1 MythBuster is HIV is a death sentence. Oh, you get HIV, oh, you're gonna die. So not the truth. So not the truth. And with that, with arts, and you're gonna hear me say arts a lot, which stands for antiretroviral therapy. So with art, people can live a normal lifespan as long as the person is compliant with their regimen. So that means if you are taking your pill once a day or whatever regimen your doctor has you on, as long as you are compliant with that, you can live a normal, regular life. There is no excuse why you can't continue on living. There is no reason why you should just give up on life. Like my sister Chloe said, it's taking back your life, understanding that it's your responsibility now to keep on living. That should be your desire. So HIV, however, it used to be this scary thing because it was taking people out of here left and right, left and right. It is not that anymore. Science has advanced medication so far now to where it goes into my next myth buster is you can tell if a person has HIV or AIDS just by looking at them, and you cannot. That's because that person that is living with HIV who receives art can be relatively healthy and is no different than another person who has a chronic health condition. Now, because of I know because of Corona, well, we like to call her Rona. A lot of people living with HIV fell up under that category of remaining safe and staying home. However, this is my personal opinion, don't mean nothing outside of me. I feel like as long as you are taking care of yourself and you're taking the necessary precautions to do what you need to do on your end, you will be okay. You will be just fine. As something that my sister Chloe introduced me to, which I thought was very fascinating when I was reading it, elite progressors and long-term non-progressors. Y'all, let me tell you something. I was so fascinated by this information. I was reading it. So, sis, you can chime in if you want to, but I'm just going to read some of the information that was given, that I was reading that I thought is very helpful for people to understand and know that HIV comes in so many different forms and living in people differently that we don't even know. So, it says HIV long-term non-progressors are people that are living with HIV who do not take antiretroviral therapy and still maintain a CD4 count in normal range indefinitely. I thought that just blew me away.
Mm-hmm. Yes.
That blew me away.
The street term that we've always used was carriers. People say, she or he or they or I am a carrier. Like they'll say that. But in reality, that's what it is. It's called a elite controller or a non-progressor. Yeah, absolutely.
Wow. And so in my research, what I noticed, they said that they can keep a CD4 count higher than 500 with a detectable viral load for years.
Yes, absolutely.
Up to 10 to 12 years, according to the research. And I was like, wow. So that's something else that, that I thought was very, very interesting. And elite controllers are somehow similar. It falls up under the same category. It says now for them, it says art is recommended for elite controllers when the CD4 begins to decline, or if they start having or develop complications due to HIV. So I think that's important for some people to know, because that's something that I didn't know, that you can be a carrier, like Chloe was saying, and be and just be undetectable for a number of years. So that goes to show you that you don't have that you can be living with HIV and be a elite progressor, or I'm sorry, elite controller. That is amazing.
And this is why it's so important to make sure you as an individual take control of your own sexual health.
Absolutely.
I have no idea where another person is with their own status, or if they're even aware.
Mm-hmm. So the third MythBuster, y'all ready? Is straight people don't have to worry about HIV infection. Listen, the same way cancer doesn't have a name on it, no disease has a name on it, the same way we say bullets don't have names on them, HIV does not have a name on it. It doesn't have a gender on it. It doesn't have a sex on it. It doesn't have a color on it. It doesn't have an age on it. It just doesn't. This is something that everyone should know about. And if you do come in contact and you do become, infected, there are ways for you to keep living. There are a list of medications that have been out for a long time. However, there are a lot of, I'm sorry, yeah, I'm pulling up my notes. There are a lot of medications that they have now that actually are tied into like 3 medications tied into one. And Chloe, help me with this, where they even have some medications that are actually blockers to prevent HIV from copying itself.
So the way that these medications work, so I don't really want to get deep because I know the audience. So
yeah. Just kind of make it.
So we'll say we have inhibitors, right? They're called inhibitors. So you have transcriptase inhibitors, and so what happens is there's this whole on a molecular level, there's this whole thing where you have the cell that is HIV cells that enter the body, and then you have your healthy cells. And this is very similar with coronavirus, as we've seen recently. So you probably heard something similar to this in relation to coronavirus. But you have the healthy cell that's in your body, and then you have the HIV, and then the HIV cell, just like the coronavirus has the little spores, like the little things on it, that HIV cell has those spores in it, and your cell has receptors, and they kind of land and lock. And at that time, the nucleus and the RNA of the HIV cell, it kind of puts itself inside of your cell, and then your cells replicate as they normally do. That's just normal practice that they do. And at that point, you build up the infection. So what those medications will do is stop that replication process. They'll the HIV RNA from being able to duplicate over and over and replicate again. And that's when you have what's called non-detectable or a low viral load, and et cetera, because you don't have the replications in your as a person who is not on ART. So yeah, awesome.
That's amazing. That's amazing. So that's another MythBuster. So just because you're straight, that don't mean nothing. You can get it too. It like I said, HIV does not have a name on it. Sex, race, religion, nothing. Anybody can come in contact with this, but it's remaining compliant to get to that undetectable status. MythBuster number 4. HIV positive people can't safely have children. No. I thought this was very, 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 very interesting when I was reading up on this. So according to the research, it says as long as women take their antiretroviral, y'all, this word is gonna eat me up every time I say. I'm just gonna say ART, okay? During the pregnancy, labor, and delivery, she must continue to take ART 4 to 6 weeks after her birth after birth, where the risk will be less than 1% for the baby to contract HIV or show a positive reading of HIV. As well as this too, this is for the guys, women who are negative but have a man who is positive and is compliant with their medication, the risk of transmission is virtually zero if the viral load is undetectable. So guess what? There is hope for you to have babies, y'all. It's all about remaining compliant. You want to say something, sis? You want to say?
About to say, I know a couple that did that, and also there's this piece about it where a child develops their own immune system, etc. So that's a whole nother. But the child develops their own immune system, and it was successful. The children were HIV negative.
That's amazing. That's amazing. So there are stories that are out there where if people want to start a family, you can have a family. So that don't let this don't let HIV stop you. Don't. Number 5, PrEP and HIV, and since I'm kind of crossing over into your lane too a little bit. It says PrEP and HIV treatment interferes with HRT, hormone replacement therapy for trans women. So there was a study completed in 2018 with a group of 20 negative trans women who did not have HRT for the last 6 months and started a 15-week study to show that there were no interference with HRT and PrEP, as well as HIV positive people with an undetectable viral load who had no bearings or showed no signs or issues being on HRT. So that means as long as you are undetectable, you're HIV positive, but you're undetectable, HRT, if you are a trans woman, I can't speak for trans men because I love my sisters. So there are no barriers there that will block your HRT, your estrogen from working. You will still, develop breast development. You will still do whatever HRT does for your body. You will be just fine. There's no blocking it. There's no stopping it. There's nothing. If you are positive and you are one of my trans sisters, please understand, get to that undetectable viral load so you can continue to live, and take your HRT and just keep going. There's no interference. There are studies done across the board for this. This was just one of them. And so with these studies, it will prove that a lot of things that a lot of our sisters may be weary of, they know now that there was just not this study, but a lot of other studies done that you can still get your breast development, because I got mine, I ain't had no surgery. So you can do this.
I want a reduction.
You want a reduction? Sis, yours are actually popping. I will say that yours are actually popping.
But to the point, it's sad, but it's not that we leave the guys out. It has just been very, very, very minimal, if any, research done. So it's hard to confidently say anything about the interference for trans men or trans masculine individuals because that research just has not been done, but it is starting. Well, it was actually there was a transmasculine study that's in the midst of beginning, but it was some interference from COVID-19. So.
Oh, wow. That's amazing. So, brothers, we got y'all coming. Y'all on the bandwagon next.
Absolutely.
Getting around with everybody. All right. So, we're going to keep this going. So it says, okay, so MythBuster number 6 is undetectable people can still give a person HIV. Is this true? Is this true? Let's see. All right. So, written April 24th, 2020 by Whitney Akers, the CDC agrees that a person with a undetectable HIV status cannot transmit the virus.
Oh.
Shut your mouth and keep on talking. Listen, it said the CDC wrote, when ART results in a viral suppression defined as less than 200 copies per milliliter or undetectable levels, it prevents HIV transmission. Now, sis, because you are the clinical researcher guru of all things, what say you to this information to those people that may have had, that may have just been in the heat of the moment and, you know, had sex with someone who was negative, and this person is undetectable, been undetectable for 4 or 5 years. They're compliant, and it's that one slip up, and it's like, oh my God, you know, I didn't disclose my status, or I didn't tell them this, or I didn't tell them that. What do you say to those people that are negative? What do you say?
Well, TBH, don't slip up.
That part.
But in the event that that does happen, yes, because there is very minimal replication in the body of the HIV positive individual, it is virtually impossible to transmit HIV if you have an undetectable status to someone who's HIV negative. Yeah. So, but this doesn't mean just keep doing it and keep trying it and keep.
Listen, children, listen.
And mature, because we do have other things to worry about, though. You still have syphilis, you still have gonorrhea, you still have herpes, you still have a lot of other things to worry about. So try not to slip up as much as you can.
Absolutely.
But, yes, you can have a sense of confidence in knowing that it's very unlikely that you transmitted HIV to someone.
Absolutely. So those people that may not have a undetectable viral load, get there. You know, you still want to practice safe sex. You still want to remain compliant with your regimen. You still want to have and live a healthy life. You still want to keep, if your partner is negative, you still want to make sure that you're taking all necessary precautions to prevent other STIs and STDs, just not HIV. Okay, so that's another myth buster. And I want to say this: there were when I was reading this article, it says there were 3 studies done, and it was sex without a condom, and they used PrEP, and then positive person with a undetectable viral load. And they had sex with their negative partner. And the conclusion from this study was that there were no signs of transmitting HIV to a negative partner. And this was a 6-month study that was done back in 2019. Mm-hmm. So it didn't say how many people were a part of this study, but it just goes to show how far science and medicine and all of these studies and people being compliant with their medication, how it can show you can live a healthy and a very vibrant, prosperous life. You can start a family if you want to. Excuse me. So those are 6 myth busters with HIV. And I definitely want to cite the CDC, where I received my information, healthline.com, also the U.S. Department of Health and Human Services, and the HIV Plus magazine. So those are my 6 Mythbusters.
So I definitely want to include, for everyone who is watching, for our viewers, what if you are HIV negative and you are looking to start PrEP? How do you get on PrEP? What if you may potentially be or are HIV positive and you need to get on antiretroviral medication and therapy? What do you do? How do you go about doing that? Everybody be local who's watching this. So I just think that a great place to start is your local county hospital is a great place. And PEP. Most emergency rooms should offer PEP, but your local county hospital, for instance, in Atlanta, Grady Memorial Hospital, the ER does offer PEP, and they do have a PEP clinic, as well as your local health department, like Fulton County Board of Health has a PrEP clinic. And for treatment, same for treatment. And also your primary care physicians, if you may have a physician. So I think that if you are out there somewhere and you don't know where to start, you can always start at your local health department, your local hospital. And usually they have some type of clinic or connections to a clinic.
Yeah. So I want to say this here, sis. I was reading something, having a conversation with someone about other people are oppressing other people, and I thought this fit this conversation perfectly, because going back to one of my Mythbusters, when you're talking about a person being able to identify a person who has HIV and or AIDS, and people that are living with HIV, and or if they are in the stages of AIDS, people tend to kind of be oppressed or oppress them and have certain prejudices against them. And I saw this word ableism, and ableism includes the prejudice, exclusion, and discrimination of people who have a mental and or physical disability or difference. So I definitely want people to understand that if a person is living with HIV and they're undetectable, or if a person is detectable and or if they're living with AIDS, we should not be prejudiced. We should not discriminate. We should not exclude these people from society, from civilization, because just like anything, there's no cure, but it can be treated and it can be maintained. And so I just wanted to put that out there. Let's not be ableist, okay? Let's not do that to our brothers and sisters that are living with HIV. I just definitely want to say that.
Absolutely. That contributes to the stigma of HIV. And that can actually lead to a person not getting tested or not sticking to an HIV regimen because they don't want to go to get tested, or they don't want to have or possess the medication, or they don't want to go into the clinic atmosphere to get treated. And that can lead to their death. So it's very important not to do that. It's extremely important. It's literally life or death.
Absolutely. Absolutely. So do we have any questions? I'm not sure if we have questions or not.
Are there any, Regina?
I'm not sure if we can tell if we have questions.
Oh,
Well,
questions out there, people?
well, I guess we could just keep talking, I guess, until we get an answer.
If you have questions, make sure you send make sure you send your questions. I know you all have to have some kind of questions, but if you
Absolutely.
make sure you send your questions. And thank you once again for tuning in, watching us. I hope everyone is enjoying their Juneteenth.
Yes.
Enjoying their Juneteenth.
So sis, with PEP, how old are these medications, PEP and PrEP? How old are these two new medications?
So PEP and PrEP, well, so right now there's Truvada for both, and then Descovy is a newer drug. So Descovy was just FDA approved last year. Was it last year? It was last year that Descovy was FDA approved to become a PrEP agent. And we've been also looking, like one of the first research projects I worked on, which actually has been found to be efficacious or effective in its way, is this injectable cabotegravir. It's something that I posted on my social media platforms maybe a while back, a few weeks back or a month back. But it was found to be effective in the research study process. It has not been put on the market yet. It has not been FDA approved. But once it was a double-blind study where the participants did not know what they were getting, if they were getting the real cabotegravir or if they were getting a placebo, and neither did the staff. No one knew what they were getting. So when they unblinded the study and unveiled, it was found to be effective in this phase. So
Wow.
it's definitely progressed to the next phase. And yeah, so hopefully we're hopeful that it will be an injectable PrEP. And that will be the newest thing. Yes, but Truvada actually is not a new drug. It's new for PrEP. Believe it or not, the folklore around it is that the Rave Society actually conceived the concept of what we now know as PrEP. They were some of the first folklore, allegedly, they were some of the first to like have boyfriends who would be positive and negative, and then the positive ones would share their ART with the negative partners in hope of not contracting HIV. So from what I hear is where the logic behind taking an antiretroviral for prevention was developed and came from.
So I did want to ask another question too. So with the injection, so is that once a month or is that
every 3, believe it or not?
Every 3 months.
The cabotegravir is administered every 3, would be administered and effective every 3 months. So you only have to take it quarterly, 4 times a year.
Okay.
Fall, summer, spring, winter, maybe. And
there you go.
Yeah.
Nice. I like that. Cool. Awesome. So I'm not sure if we have any other
any questions
or anything like that.
Regina?
Yes, ma'am.
Are there any questions?
I've been looking. I don't see any as of now.
Okay.
You have some avid listeners, but no questions right now.
All right. Awesome. Well, I guess we must have covered everything, covered our bases.
Yeah, very well at that. I just want to say thank you to Regina, aka Miss Natalia Dupree, from Unspoken Treasure Society, just for offering a platform of education and knowledge for our community and abroad, because this is information that some people may find too much to ingest, you know, by themselves. So I just want to say thank you so much for allowing us to come on and share what we've learned, and actually having our sister Chloe, who actually is a clinical researcher of this type of information. So thank you so much for having us. I really do appreciate that.
You're so welcome. You're so welcome.
It's an honor. Thank you so much. And thank you so much for giving us the platform to be able to reach our sisters out there in the universe and spread this information. Thank you.
You both are so welcome, and I appreciate you too. And y'all both know that if there's anything you need from me, I have you.
Absolutely.
And I love you ladies to life, and thank you so much.
Thank you so much. Y'all
and our listeners and the people that tuned in, thank you so much. You all had some amazing information poured into you all tonight, so I hope you all took advantage of that. I see you didn't have any questions, however. I just hope you took advantage of this very important information.
And if you do, you can feel free to reach out. It's Cholie Jordan is my Instagram, so people can always DM me and reach out if you do have questions. If maybe you're not confident or comfortable asking your questions here, that's fine. You can always reach out and ask questions. People do all the time anyway. That's what prompted this.
Absolutely. And also you can find me, Zarion Newbill, on Facebook. I was going to say Facegram. Jesus. Zarion Newbill on Facebook, and also Queen Amunette on Instagram. If you have questions, and like I tell people, if I don't have an answer, I can connect you with someone who does have an answer and give you accurate information.